regenerative medicine as we know it is a misnomer. The commercially available products like platelet-rich plasma and stem cells reduce inflammation. However, there's no evidence yet that we're regenerating tissue. Yes, there's some studies in the investigational world that do regenerate tissue. However, those studies are one, difficult to replicate and not ready for commercial applicability. What we do know is that yes, they reduce inflammation. However, the issue is that the stem cells in plasma, those therapies are done in individual clinics, and it's hard to ensure quality and standardization. So that's where exosomes come in. One, they are done in a certain lab that's standardized and controlled by the FDA. In addition, they represent the next generation in plasma where the growth factors that attract the anti-inflammation are concentrated to a much higher degree. And not only that, but they're able to communicate with the cell much more efficiently. So an exosome simply is a type of lipid bilayer. It's an endosome where the growth factor can enter a cell more easily. When you're receiving plasma, the growth factors are floating around and they're injected into the general area. However, many of those growth factors won't enter the cell because they don't have the necessary envelope, you could say, to enter that cell. Stem cells are the same idea, where we are using growth factors to help the body heal itself. But stem cells, stem cells are a much more invasive process. You have to harvest bone marrow from the iliac crest usually. It's more expensive and more painful, and really research has shown it functions by the same mechanism, paracrine, where it attracts growth factors to it. And even then you have a small amount of exosomes in plasma in stem cells, but not to the degree that you have in the exosome therapy. And that's why I believe exosome is right now our best hope in creating a type of regenerative response, which is anti-inflammation and reducing some wear and tear on the joints.